Hamsters are masters at hiding their pain and illness. It's a survival instinct from their days in the wild, where showing weakness meant becoming prey. This makes it incredibly difficult for even the most attentive pet owners to recognize when their tiny companion is approaching the end of their life. Understanding these silent signs can help you provide comfort and make important decisions about your hamster's care when they need you most. One of the earliest and most subtle signs is a change in eating habits. You might notice your hamster stops hoarding food in their cheeks or leaves their favorite treats untouched. They may visit their food bowl less frequently or only nibble at small amounts. Some hamsters will continue to go through the motions of eating, but you'll notice their food supply isn't actually decreasing. This gradual loss of appetite is often one of the first indicators that something is seriously wrong. Yet it's easy to miss if you're not weighing their food or watching closely. Along with reduced eating, you'll likely observe significant weight loss. A healthy hamster has a rounded body shape, but a dying hamster begins to look angular and bony. You might be able to feel their spine and hip bones more prominently when you gently handle them. Their cheeks may appear sunken rather than plump. This weight loss can happen gradually over weeks or more rapidly in cases of acute illness. When you pick up your hamster, they'll feel noticeably lighter in your hands, almost fragile. Changes in activity level are another critical warning sign. Hamsters are naturally active creatures, especially during their wakeful hours at night. A dying hamster will become increasingly lethargic and withdrawn. They'll spend more and more time in their nest, barely emerging even during peak activity hours. You might notice they no longer run on their wheel, something that was once a nightly ritual. When they do move, their movements seem slow and labored, lacking the quick, energetic bursts you're used to seeing. They may sleep in unusual places or positions, sometimes even out in the open, rather than in their usual hiding spots. Their grooming habits will also deteriorate noticeably. Healthy hamsters are meticulous groomers, constantly cleaning their fur and face. A hamster that's dying will stop taking care of their appearance. Their coat becomes dull, matted, and unkempt. You might notice clumps of fur sticking together, or areas that look greasy or dirty. Their eyes may develop crusty discharge that they no longer bother to clean away. This lack of grooming is both a sign of physical weakness and a loss of interest in basic self-care behaviors. Breathing changes are particularly concerning and often indicate serious distress. You might hear wheezing, clicking, or rattling sounds coming from your hamster. Their breathing may become labored, with visible effort in their chest and abdomen as they struggle to draw breath. Sometimes you'll notice them breathing with their mouth open, which is never normal for a hamster. The rate of breathing might increase significantly, or conversely, become very slow and shallow. These respiratory signs suggest that your hamster is in significant discomfort and their body systems are beginning to fail. Temperature regulation problems often emerge as a hamster's condition worsens. They may feel unusually cold to the touch, indicating their body is having trouble maintaining its core temperature. You might find them seeking out warm spots more frequently, or burrowing deeper into their bedding than usual. Some hamsters will stay pressed against a heat source if one is available. On the other hand, some dying hamsters become unusually cold and unresponsive, entering a state that resembles hibernation, but is actually a sign of critical illness. Changes in their eyes can be subtle but telling. A healthy hamster has bright, alert eyes that respond to movement and light. As they decline, their eyes may appear dull, sunken, or glazed over. They might stop making eye contact or tracking movement the way they used to. Some hamsters develop a distant, unfocused stare. You may notice they're less reactive to your presence or to things happening around their cage. This diminished responsiveness suggests their sensory awareness is fading. Mobility issues often develop progressively. You might observe your hamster stumbling or losing their balance when they walk. They may drag their hind legs or have difficulty coordinating their movements. Some hamsters develop a head tilt or circle repetitively in one direction. They might struggle to climb levels in their cage that they previously navigated easily. When you pick them up, they may feel limp rather than wriggling to escape or explore. These neurological and muscular symptoms indicate their body is shutting down. Social behavior changes can be heartbreaking to witness. A hamster that once enjoyed interaction may become withdrawn and unresponsive. They might not react when you open their cage or offer treats. Some hamsters become irritable and may try to bite when handled, which is their way of communicating they're in pain. Others become unusually clingy or seek out more contact than normal, as if they're looking for comfort. Either extreme represents a significant departure from their typical personality. Bathroom habits often change in the final stages of life. You might notice their urine is darker than usual, or they're producing much less. Diarrhea or very soft stools can develop, sometimes with an unusual odor. Some hamsters lose control of their bladder or bowels, leaving messes outside their usual bathroom area. Their bedding might become soiled more quickly because they lack the energy to move to their designated spot. These elimination changes indicate their internal organs are no longer functioning properly. Perhaps one of the most difficult signs to witness is when your hamster stops responding to their favorite activities and treats. Foods they once went crazy for no longer interest them. They won't come to the cage bars to greet you. The toys and wheels they loved sit unused. This withdrawal from all the things that brought them joy signals that they're conserving what little energy remains and that their quality of life has significantly diminished. If you're observing several of these signs in your hamster, it's time for an honest conversation with your veterinarian. While hamsters have short lifespans, typically 2 to 3 years, that doesn't make their end of life any less important. A vet can help you determine whether your hamster is experiencing a treatable condition or if they're truly in their final days. They can also discuss options for pain management and help you decide if humane euthanasia is the kindest choice to prevent suffering. During this difficult time, focus on keeping your hamster comfortable. Ensure their environment is warm, quiet, and stress-free. Offer soft, easily accessible food and water. Minimize handling unless necessary. Sometimes the most loving thing we can do is simply be present, offering gentle comfort as they make their final journey. Remember that you gave your small friend a life filled with care and love. And that's a beautiful gift, no matter how brief their time with you was.